Hi, and welcome to Dear John. For Breast Cancer Awareness Month, I've asked physical therapist Jodi Winicour to join me to talk about some common questions about breast cancer and lymphedema. Jodi's written courses on post-breast cancer care and lymphedema, and I wanted to tell her thanks for joining us today. Jodi, 1 in 8 women will have breast cancer at some point in their life. This is a really big issue, and in fact, it includes men as well. But there must be some risks that you want to talk about related to lymphedema for these breast cancer patients.
I do, John. Thanks for inviting me. So the breast has lymph nodes that drain it, and they help to prevent infections. They help to prevent swelling. They definitely provide fluid balance, and they help filter out things like viruses, bacteria, and cancer cells. And so when someone has breast cancer, part of the staging process is they actually have to remove some of those lymph nodes in the axilla or armpit. So once lymph nodes are removed, that immediately puts someone at risk for breast or arm swelling. Generally speaking, I would say the more lymph nodes that are removed, or in the case of someone needing radiation, if they still have a breast, or if they have a positive node after surgery, they're going to need radiation. That's going to increase their risk of getting either breast or arm lymphedema. Also, generally, the number of nodes removed, so the more nodes that are removed and or the more radiation that is done, that's going to increase their risk. Things like being overweight or being obese can increase the risk. Also, if someone gets an infection after surgery where their breast or arm gets really red and hot and swollen and uncomfortable, that can increase their risk for lymphedema as well. And strangely, if someone chooses no reconstruction after mastectomy, that increases their risk. People who do get reconstructed have a lower risk of lymphedema, which is a little counterintuitive. And then lastly, if someone has chemotherapy after surgery, that can increase their risk.
Thanks for that. You know, there's a lot of things that are said about lymphedema, and there's a lot of misconceptions, like you may have done something or didn't do something. Do you want to talk about some of the most common misconceptions about lymphedema?
I do, and that's a really good question because a lot of people who do develop lymphedema blame themselves for developing it, when in fact, there's so many various risk factors. There's genetic risk factors. You know, there's some people who are just at increased risk for getting lymphedema after their surgery, and the surgery itself is the trigger. There's some people who have anatomical or physiological predisposition to developing lymphedema after surgery, and you can't change those things. And generally speaking, I would never ever blame someone for doing anything that increases their risk. And because a lot of times they don't know that it could, but generally speaking, 2 really big misconceptions are that exercise is bad for people who are at risk for lymphedema or who has lymphedema. And that's just not true. We have lots and lots of studies showing that it's very, very safe, especially if you start low and go slow. So you start easy, especially if you already have lymphedema, you want to do it under the supervision of a lymphedema therapist or a physical therapist or occupational therapist who is trained in that. And then you can do weight training. You want to condition your lymphatic system in order to handle everyday normal activities. The other one is that everyone who is having cancer treatment, has to go to an oncology office, and occasionally they'll be in an office where someone has really terrible looking lymphedema. And in those cases, in most of those cases, it's because it's their disease that has gotten out of control. It's not because they have untreated lymphedema that is caused by just the surgery or the radiation. And so I just want to be clear that if someone does develop a quick onset lymphedema in their arm or their breast, they need to get checked out by their doc because it might be that they have an infection or they could have a blood clot. Those are the 2 most common reasons why someone could have a sudden onset of lymphedema. But generally speaking, it's a very slow onset and they just might notice it one day, but it shouldn't be severe. It should be kind of slow and getting worse over time.
Right. And I often recommend to patients that, it's more about cancer caused this. You never had it before you had cancer. This is due to your cancer.
Absolutely. That's a really good thing to say.
Many times people talk about lymphedema and they say it's about the size. There's research that says a little bit about sizing and all, but what are the other symptoms you tend to see with lymphedema?
Another great question, John. Symptoms are highly variable between people. I would say the general ones that most people say is it could feel full or heavy, or their skin could feel tight. You might not be able to see the veins like on the back of your hand, or if the breast is swollen, their breast might be cutting into their bra is like cutting into their breast and giving them a dimple on their breast as compared to the other side. Frequently, though, there are no symptoms. There are some folks who it just looks swollen, or it feels, maybe it just feels a little bit heavy, but I wouldn't expect a lot of pain. If you're getting a lot of pain with lymphedema, you need to see your doctor, again, because of the risk of cellulitis, which is an infection, or blood clots, or God forbid, the cancer is back, which is very unusual. But those are the main reasons why someone would have a lot of symptoms. Generally, they're very mild.
Great, thank you for that. What are other things that can be done for a patient to reduce the risks of lymphedema if they don't have it, or reducing the problems if they already do? What can they do to manage it or minimize the problems?
Again, a great question, John. I really like to focus on the positive and what we can do, as opposed to being afraid of it. And so really one of the most important things that you can do if you're at high risk, okay, so let's say you're overweight, you had 8 lymph nodes removed, you also had radiation to the lymph nodes, that would be someone who's at a higher risk of lymphedema. Those are the patients that I want to monitor, as a lymphedema therapist. I want to see them quarterly. So usually I see them every 3 months for up to 2 years, and sometimes longer, depending on how they're doing. You can either do that with a therapist, or there are some doctor's offices that have a device that they can monitor electronically. They can actually measure the swelling on the inside of your arm. I just use a tape measure, and then my doctor's office has that device, so we use it in combination. And then if we start to see a subtle change in their swelling over time as it's going up, right away we're getting them into compression. So compression garments, a sleeve, usually we don't have to use something on their hand if it's that subtle. But it's really important to get that garment on them right away. We have great evidence that shows that can reverse the lymphedema, and frequently it does not become a chronic problem. Or even if it does become something they have to deal with, it's much easier to deal with than if we had ignored it for a long period of time and waited till it was really visible and giving them symptoms. So compression is key. The other thing they can do is, for instance, if they still have their breast, like with a lumpectomy, is after surgery and then also after radiation, to make sure we get that swelling under control right away. And again, that's with compression tank tops, or, in rare instances, maybe a custom garment. And then also with a special kind of massage that we do for swelling related issues, and keep close tabs on that person. Sometimes if they go into radiation with swelling, I'm seeing them throughout the radiation to help keep that under control so it doesn't get out of hand. Other things that you can do is to help reduce the risk of lymphedema is to control your weight, which I know can be hard. But generally speaking, we're recommending at least 150 minutes of exercise per week, where it's moderate intensity. That means you get a little bit of sweaty, you get a little bit out of breath, but you can still hold a conversation. And then that should help to control your weight. Again, weight training is really important to do, and it has to be done in the right time frame. So that's why we recommend you see a physical therapist or a lymphedema therapist who's familiar with lymphedema to get you started on exercise. The other, I guess that those are the main ones: exercise, weight control, compression. Getting with the lymphedema therapist to help address any inflammation that could turn into lymphedema over time.
Great. Those are great answers. I really appreciate it. One more question. Is it ever too late, in your opinion, to have the lymphedema or the shoulder issues addressed with the post-oncology patient?
Is it ever too late? I would say no, it's never too late. The best time to do that is within the first 2 years of treatment. And that's because the healing phases of wounds after surgery and from radiation take about 2 years to fully recover. So I can almost guarantee I can get somebody's function and motion back to normal, because we measure people before they even have surgery, and then we follow them after. And if it's within those 2 years, I can usually get their motion back unless there's some unforeseen circumstance. Tissues will always be a little bit different within the radiation treatment field. But again, exercise, cardiovascular exercise and stretching help to give good circulation to those areas to help them fully recover. The whole idea is to reduce the amount of scar tissue and hardening of the tissues that happens in order to keep the lymphatic flow normal. So yeah, great question, John. It really never is too late. And if someone comes in later than 2 years, I can improve things. I just might not be able to get them to their pre-surgery level, but we can always make things better.
Great. Thanks, Jodi. You're awesome. Listen, guys, if you have other questions, please feel free to reach out to us at juzousa.com looking for Dear John. We'll see you next month.